patients have no idea if you're doing a good job or not clinically until either much later or until you put them in a lot of pain. And then how they feel emotionally as they go through the process.
Someone goes to a weekend course. They learn how to do All-on-X to whatever level that they think that they're ready to do it at. And then you say, okay, Gary, how much for your marketing services? Because we're going to start getting these patients pouring in. And it's like, well, how many arches have you done? Like -1. The first step is, what's your skill level at as a surgeon, and what is the quality of product that you can deliver on a very objective side? When you get started with anything, it's managing your skill set and then figuring out the workflow and getting the kinks out of that one case so that when you do your next case, it's smoother.
Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help offices like yours level the playing field so you can compete and grow the way that you want. And today I got Dr. Nguyen with us, and he's going to share how he has grown to a consistent 10 arches a month without sacrificing quality. If you're a clinician and you really want to learn about growth, but doing it the right way, this is a great show. And I promise you, you're going to enjoy it. We talk about the good, the bad, the ugly, and what you can do to actually reach your goals in a responsible way. Stay tuned. All right. I am live here with Dr. Nguyen. And if you feel like, man, didn't Gary just talk to this guy? I did. And it was so good. We were like, let's do a second one. And the reason was he was just so transparent about the bad stuff, which I love. That's, I think, is the most valuable content because it's the hardest content to get our hands on out in the full arch world. And I said, man, I would love to have you come back on and tell me about the good stuff now. And I think you're going to trust him a little bit more because he understands the bad stuff and the things that you should avoid. And he explained that. If you haven't watched that episode, go watch that one. It's just a couple episodes back. But Dr. Nguyen, I wanted to talk to you. So right now you're doing roughly about 10 arches a month, but the way you grew is a lot different than what most doctors would consider growth, especially ones that might only be doing an arch or two a month right now. And it's very, very unique. And I don't think most doctors understand this. So I would love for you to kind of break down how you got to this point.
Sure. First off, thanks for having me back. Hopefully this is a little bit more happy. But so I'm an oral surgeon, and that makes inherently doing more full arch a little bit different than it would be as a generalist, which is typically keeping the surgery and the prosthetic in-house. And their marketing is a little bit different because they're 100% focused on gathering more patients from the public. As an oral surgeon, classically, we are more referral based. And of course, we're surgeons, meaning we're more responsible for the surgery. And then we send them back out again for the restorative.
You've probably noticed this before, but this podcast is unsponsored. What that means is we don't get paid to do it, but we want to bring you the best information possible. So how do we make sure that this content stays on the air? We need you to like and subscribe. Wherever you're at, whatever you're listening on, just give us a thumbs up or subscribe. And that helps us out so much. I know that you probably haven't done it, so I'm just going to sit here and wait until you do. 95% of our listeners have not subscribed to our podcast. So go ahead and do it now. Don't make this awkward. All right, good. Back to the show.
Mm-hmm. And that makes things confusing for patients. So when I first bought my practice, it was an acquisition. They weren't doing a whole lot of really anything, but I was desperate to buy practice. So I was like, let me just get out of here. And I was sick of working for people. But long story short, they weren't doing a lot of full arch, period. Where we started coming in was mostly just quality of product. So the practice wasn't very busy, and there were other providers that saw the way things, saw how to do things differently. Mm-hmm. And I came in and basically said, this is the way we're doing things now. We're focusing on quality, patient experience. And I know it sounds like a broken record because everyone says that, but it's a lot harder to achieve than you think, because you've said this before in your podcast, selling a high dollar case is a lot different than selling your bread and butter cases.
Yeah.
But the nice thing about being an oral surgeon is most of our cases are not cheap anyway. So we, on the treatment planning side, are pretty good at talking to patients about, large treatment plans and their options and everything like that going down the road. So integrating full arch wasn't that big of a deal other than the restorative side. And so on the clinical side, it was doing a good job. That's number one. Like, so, the surgery part is the foundation. You have to have the end product in mind, meaning the prosthetic. So I had to learn a lot of prosthetic stuff. And then I could translate that to my surgery, which we are already used to that anyway. And then finding a good way to have communication with the patient to translate all that to, we'll do a better job. And then as we started doing a better job, we inherently started doing more full arch. So I didn't really throw a bunch of marketing money into the public marketing. I do some, I'm not going to lie. Some.
Yeah.
But in the end, our growth for full arch became mostly organic off of patient experience, quality, and me having a way to make sure that the prosthetic, which is what the patient cares more about anyway, is excellent.
Yeah, I totally agree. Now, one of the things that we talked about before we hit record is we were talking about, you said one of the best ways to grow is to have an amazing product. And that means you do an amazing job of doing the procedures in such a way that you are actually, the patient's going to be better off moving forward and they're not going to be in pain and those kind of things. And what I said to you, and I want to kind of rehash this conversation for our audience is, okay, that's great for you as the doctor, because that's a good full arch right there clinically. That is not a good full arch clinically. But as the patient, for me, I have no idea if you put two doctors, the best full arch doctor in the whole world versus the not best, right? Somebody who's not good and maybe newer. If they both talk to me clinically, I'm going to have no idea which one's accurate, right? Or which one's, I might believe both of them. They might both sound really good. It's the only thing I have to base my experience on is the patient journey and how the cost is presented to me. And then I have to make a decision based off of that. So could you walk me through kind of how you view that from a clinical standpoint?
Yeah. So first off is quality of product. So when you sell anything, whether it's a service or a product, it has to be a quality product if you are trying to make it of value. And when your patient spends X amount of money on that product, they have to feel like it was worth the product and the experience and everything like that. And then they're going to tell their friends how good you are, right? Especially if it's a high dollar, big risk surgery, like a full arch. And the variability of that comes, unfortunately, the easiest way is just word of mouth. Just do a good job. And if the patient is already coming in and saying, hey, you worked on my niece or nephew or my brother, and it was just some wisdom teeth, just an implant, but then they saw that you do full arch and they were like, hey, they reached out to me and said, maybe you should talk to this guy because I had a really good experience in his office. Mm-hmm. And so when you have these full arch only practices, they don't really get to they have to just do full arch or insurance or something like that. I still do bread and butter oral surgery. So I'm still like summer right now.
I like that term. That should be a new term. Bread and butter oral surgery.
Yeah, that is a term. I mean,
okay, I've never heard that before.
Yeah,
that's awesome.
So teeth and titanium, that's what we call it. So oral surgery is we can fix a whole cracked face and then we can chuck wisdom teeth out all day, right? So, but by doing that, you're introducing your practice already to a whole ton of people. And then they're going to have a good experience and everyone talks, especially with the internet. And so if somebody needs something, they're like, hey, this guy does a really good job. And it looks like he does some of that stuff that you're looking for. Why don't you go talk to this guy? So, I mean, but that's okay. But then going back to, you hear these people have all these sales tactics and all these things about selling a product. And the problem with full arch is there's variability because it's a human. Okay. Yeah. I said this before. Yeah. You're dealing with a human. We're not cut with a machine the same way. And this is a big problem for a lot of engineers and business people because they think that they can sell it like we are cut like a machine and built the same. And we're not. And we think differently and we're built differently and we have risk factors and we have turn-ons and turn-offs. And that's something you have to have a good treatment coordinator for, yes, but also you have to watch out where your sales tactics are because the biggest mistake that you can do is sell a lie. And I see a lot of people sell like and they're
What do you mean by that exactly? Like, what do you mean by selling a lie?
Sure. So in ads, I see all the time, it's going to be just like your natural teeth. You don't have to maintain it, or you don't have to maintain as much. And this is the one I hear all the time. It will last you the rest of your life.
Sheesh. Because that's not true, right?
I see that. You go on your Instagram right now and you probably pull up a couple of those. And you're already starting off with a lie. And whether you get caught in the first couple of years, in the first couple of months, or maybe 10 years down the road, you've now sold a lie. And either way, you now lose that credibility quickly, right? No matter how much you charged them for it, whether it was cheap, whether it was expensive, whatever it was. So I refuse to sell based off of that tactic alone. We're very open about the education of what this is and what I do and how we're different in terms of like my skill level. And, of course, I told you before, I teach, a lot of full arch stuff and including remote anchorage stuff, like difficult things. And I can show my work. That's the other part is like, if you look at the difference between a poorly done prosthetic, some places don't even show a lot of that stuff. And I have no problem showing what we can do to anybody.
So let me flip this. I totally agree with you. And now let me flip this on the head.
Okay.
You had to start at some point.
Yeah.
Right. Like you weren't always at the level that you're at now. Right. Clinically. So what's your advice to these doctors out there that are listening to this going, dude, then I'm never going to be able to start full arch because I can't do what he's talking about.
Do as in perform the procedure or do as in have a good patient experience? Okay,
that's a good point. So let's break down the patient experience first for the doctors, because I think clinical people get this really, really confused. Patients have no idea if you're doing a good job or not clinically until either much later or until you put them in a lot of pain. And then how they feel emotionally as they go through the process, right? When I go to the dentist, if everything's smooth and there's not a lot of hiccups and it doesn't really hurt me that bad, and I walk out of there and everything's good, I think they did a good job clinically. That doesn't mean it's true, right? And it might be the worst clinical job ever that I end up paying for immensely down the road. But that's all the education that I have around the subject. Even though I'm in dental and I know a lot about dental, I still can't understand clinical excellence, right? In the moment, besides how I feel emotionally and how I feel physically. So that's one thing. So let's take that off the table now.
Okay.
Now let's look at, you're saying, okay, well, you need to do an amazing job in driving these people in and not driving them in, on making sure that you deliver an amazing product, I should say. And you can't when you first start. So what's that journey look like when you're first getting started? And how do you work through that so you can get to a very serviceable level? Is it, like, my first thing I go to is like slow growth. The best way to do it is very, very slow, one case at a time, getting better. There might, maybe you have different ideas.
No. And you nailed it on the head. So here's the thing. Okay. Again, I teach a lot of doctors this stuff and you've seen it before because you're a marketing guy. So someone goes to a weekend course, they learn how to do All-on-X to whatever level that they think that they're ready to do it at, right? By whoever thinks that they're amazing at this stuff. And they teach you how to do it. And then you're all psyched and ready to go. And then you say, okay, Gary, how much for your marketing services? Because we're going to start getting these patients pouring in, right? And it's like, well, how many arches have you done? Like -1, pretty much.
Yeah.
So, and then they're like, okay, well, I want to do 10 arches a month. It's
yep.
Like, well, okay, buddy.
Yeah. No. I'm smart enough now to know that. So, but I wasn't smart enough. I trusted the doctor that, oh, you can do 10 arches. Sure. Okay. Right. Cause I didn't know what I didn't know, but now I know if someone tells me 0 arches as the marketing guy, they're at 0 arches and they go, yeah, I want to do 10 next month. I'm like, no, I'm not even going to take your money to do that for you.
So you asked the question, how to get started from going 0 to now. So the first step is, what's your skill level at as a surgeon, and what is the quality of product that you can deliver on a very objective side, right? Not like I learned this digital workflow over the weekend and I'm 100%. It's going to be amazing. Like, we're just going to use out everyone. It'll be 10 arches a month and then nothing's ever going to go wrong, right? So you when you get started with anything, it's managing your skill set and then figuring out the workflow and getting the kinks out of that one case so that when you do your next case, it's smoother. And then you do your next case, it's smoother. And then maybe you get a little more experience, you do a little more training, and now everything is more efficient. And then you're seeing your results are getting a lot cleaner and your patients are in maybe less pain, or you're figuring out like, this is a hard case that I should refer out and just do the restorative with this guy or whatever it is. And unfortunately, again, that's very provider specific because everyone wants to move at a different speed. And what I see is I think people are moving way too quick and trying to do way too much of this stuff. And they end up burning all their marketing money to go broke. And then if you keep trying to do it, and I said this in the last podcast, high volume, low cost is going to cost you in the future when these start to fail. And like whatever ways.
And so for the audience out there, for maybe somebody who's listening that's maybe a little bit newer, what he means is, and I've seen this and I've talked to the people on both ends of this, the people who've done this the wrong way and the people who built businesses around this, is you end up in a place where in 5 years, if you did 10 arches a month for 5 years and the failure doesn't come to the 5-year mark, all of a sudden you put yourself in a hole to have to help these people fix the problems that you created, like to the point where it becomes overwhelming. You can't even operate a business anymore.
Yeah, you're either charging the patient a second time, and then there goes your patient experience, right?
Yeah.
And then, or you're doing this for free, which means your bottom line and chair time is now negative, right? And you're in the red on that chair time. So, I mean, I have to fix my own cases and it sucks. I mean, it's like, I have to take the hit and it is what it is, but it's like, that's the cost of doing business to make sure the patient's happy. And, and you have to be very vocal about the expectations of their health and the long-term, how long this is going to last, ideally. And then, whether you're going to warranty, there's so many other little things, right? And then it's also your staff. Like you have to, you're not talking to the patient on the phone whenever they call and they're upset. So you got to train your staff on how to talk to these people, and they have to feel like you care, right? And you're married to these for a long time. So as a specialist, let's say a wisdom tooth patient, single implant patient, they're in and out. Like we don't really have to see them very often. But when you're talking about a full arch patient and you're managing not just the surgery, but you're kind of helping out with the process too, then you're seeing this patient for a long time, and they have to be happy every single appointment so they can not make you look bad when they go home, right? And that part of it is difficult, and it's more internal, and it has nothing to do with Gary's marketing company. That has everything to do with what you're doing internally as a leader and a business manager if you're owning a practice. Now, if you're on the corporate side, it's a whole different story. I'm not. That's
a different story. Totally agree.
Yeah.
And one thing to add here. So we're breaking this into, and this is how my brain works, is like 3 components, right? You got the marketing. So we're taking marketing off the table, but then you have the patient experience, and then you have clinical, and they're connected. All of those are connected. The marketing's connected to your patient experience, and your patient experience is connected to clinical, and they all have to work together. But the owner doctor has to be thinking not just clinically, but operationally, how the patient feels as they lead up to clinical. So let's say you have the best clinician in the world. They're literally skill-wise, nobody like them, right? But there's a bumpy road all the way through. They won't have treatment. They won't have cases to do because the patient won't ever get to them because the clinical part is at the end of the journey. And so you won't have any patients, even though you're the most amazing clinician ever. If it's a bumpy journey with your team, with your processes, with your financing, you won't ever get to that point, right?
Yes. So when you go buy so this is where that sales part comes. When you go buy a car and you have 2 dealerships you're going toe to toe with, the price change of a car these days isn't that much. But if I went to a dealership where the person that was trying to sell me the car was just not the guy I was vibing with, I'm not going to buy the car from them. I'll spend a couple $1,000s at the other place and give them my money, right? So in terms of skill, there's plenty, and there's plenty of this, especially in oral surgery, but like there's plenty of people that are great surgeons and great clinicians, but they can't manage people. They don't know how to manage people. So, which means that going down the running a business and being able to manage a full arch practice and all this other stuff, it's like, do they do a lot of the arches that they deserve? Maybe not. Who knows? But that's part of the game. This is America. You get a choice of where to go as a patient. And so you can price match, you can do all this other stuff. I'm not the cheapest guy in town. And I seem to do a pretty good amount of this stuff. But I do other things. So like I said, like my way of getting in patients through the door is that I offer more than just that, right? I offer more than just high dollar like dentures and overdentures and single implants and stuff. I mean, I'm still doing biopsies and pathology and all this other stuff. So I get a whole different mix of patients with a whole different mixes of needs and their own social network of people that need different things too. And, combine that with a really good Google rating, and we're really good on the phone, and I have a really good treatment coordinator. And I happen to be a pretty good clinician. So then you have magic for a really good operation. It's just that every there's a piece of everything in there. And again, I hate to say it, but like none of that matters of how many clicks you have if you can't get that patient past the phone.
Yeah, because you can be really good at marketing and suck at everything else, or you can be really good at clinical and suck at everything else. And at the end of the day, you just lose with any of those. You in full arch, you have to be good at all of it, or else you can't do any of it. And marketing could be skinned a bunch of different ways, like what you're talking about, Dr. Nguyen. Like you're more referral based, so your marketing is just like what you described, which is different than running ads and those kind of things. Doesn't mean it's right or wrong. It's just another way of marketing. But if you have to, that means your patient experience has to be that much better to be able to do more cases. And so you've been slowly building up to that. How long does it take to get good at your model? Like if I was a new dentist, let's say I'm a GP and I've done some arches and I've done some a lot of implants over the years. How long is it going to take me to get to the level of where you're at, just from an operational standpoint?
That's tough. Because it really is. That's a tough thing to measure. Because I think, again, everyone's different at managing people. Your first step is you have to manage your team. So you as a clinician have to be as good as you want to be and advertise yourself to be first, right? And that can take enough time depending on your level of a surgeon starting off when you decide you want to do more full arch, or if you start off your full arch journey. And it's just like anything. Some surgeons, like these guys, figure it out like that after a few months and they're ready to do zygos and stuff. Sure, whatever. But, there are some people that for 10 years of practice, they're still not loving the whole idea of doing, difficult cases. And then internally, again, it depends on you as a leader. Like you have to have really good systems in place and you have to have a good team. And the team has to believe in what you're trying to do. And that depends on you as a communicator, a leader, and so putting an amount of time on it is tough. I mean, I can tell you, I've owned my practice for about.
We're talking years, though, right?
Oh yeah. I mean, I didn't do. The practice started off doing very little to none of full arch, and then I didn't do my first full arch until about a year in of the practice, and that practice, right? And then I didn't really start having these numbers until the past year or two, maybe, of just doing a lot more of these and definitely doing a lot more complex cases. But I've been
Is it like other things where reps really matter? Like you have to do, the more cases you do, the faster you're going to grow, right? Like just like if I get up more jump shots, if I put up 100 jump shots a week versus if I put up 10,000 jump shots a week, the 10,000 jump shots going to get better way faster.
It depends if you're learning. So you can do the wrong Shaquille O'Neal. You can do the wrong free throw for your whole career, right? But then, or you can be improving on every case and continue to learn and then get better at the actual mechanical portion of it and getting your workflows and things like that. But again, some people just like not thinking and doing a cookie cutter approach. And then if that's the case, then you could be doing the wrong thing at 10 arches a month and I see that a lot, by the way, with the kind of practice that I have.
So it's learning things the right way. You could be learning wrong things that have to be undone.
Yeah. So it's all about putting in the time and being able to critique your own work objectively and then seeing what's working in terms of like what your patient population is, because that's different too. Like my demographics is going to be a lot different than someone else's practice as well. And some people are, if you're a lower class, lower middle class area, I mean, you can't be charging my prices in that area, right? And if you're a super high class area, then you really have to have a really good treatment coordinator that can spend a lot of time on the phone.
This is so good, man. We could talk about this more and more and more. But the thing I appreciate about you, Dr. Nguyen, is that you are willing to have these conversations around things that work, things that didn't work, things that went well, and give realistic expectations. Which, again, when you go online for full arch, this is the thing that drives me the most nuts as a non-clinician. You go online and people are like, yeah, we can get you to 10 full arches right now. And it's like, you have to consider that's a marketing person talking to you or a salesperson talking to you. It's not a doctor who's telling you this. And so you have to be very, very careful of what you're consuming and how you're consuming it, because there's the people who aren't doing things right aren't going online and making TikToks about them. Right.
Or they are, and they're telling you to take their advanced master class full arch course next weekend, and you pay them a couple $10,000 to get hands-on or something like
that. Exactly. There's a financial reason that they're sharing the information that they're sharing. And so it's like, man, how do you get information? That's why I keep trying to do these podcasts. I don't have a financial advantage to telling people don't do full arch. It's the opposite, but it's the right thing to do. And then I also don't make anything on this podcast. Like Dr. Nguyen's not making anything by coming on here and telling us this. I'm not making anything. It's just information that we've learned over the years. We hope to gain trust. We hope to build reputation, but we're not trying to charge people. So I never ask people on here, come buy marketing from me. Yeah. Come buy my course. Doctor, great job today. You did amazing. As always, I really appreciate you coming on. I'd love to have you on again here in the new future. And if there's anything that we can ever do to promote you or support you, please let us know. Love what you're doing.
Thank you, Gary. Thanks for having me on again. I do teach full arch as well. So if you do want, if you're interested in some courses, everything's in my Instagram. It's at AlexNguyenomfs on Instagram. And I'm very responsive on there too. I'm happy to answer any other questions or anything. And yeah, I'm down anytime. This is fun. So
awesome. Thanks, doctor. Bye-bye.
All right. Thanks, Gary. Have a good day.